how does gout show up on the outside? Well, the first thing it does, it gives a very hot, red, painful joint. And we know it's very painful because a rheumatologist by the name of Dr. McCarthy and the trainee at the time that he probably didn't like very much, both injected their knees with gout crystals, and they were supposed to keep track in a diary what happened at every phase. However, within a few hours, it was so painful that they gave themselves pain medications and medications to end the flare. When gout crystals build up in certain areas of the body, it can be called a tophi, or little bumps of gout that can happen all over the body. And then gout can also affect the kidneys in two different ways. It can cause kidney stones because, again, the kidney is trying to urinate out that extra uric acid, but also it can deposit in the tissues of the kidney itself, giving chronic kidney disease. And then finally, gout can also attack the joint itself because, again, the joint is sitting there where the crystal is and it gets attacked as a byproduct. So it can lead to some permanent damage. As far as the diagnosis of gout, most commonly, it's made by getting a good history from the patient or listening to what the patient is saying. Usually these flares last about 3 days or more. They're very hot, red, tender, painful joints. Usually the very first flare happens in the first big toe, which is called pedagra. And my patients will say it is so painful that even like touching the toe lightly with the bed sheet is excruciatingly painful. The second thing that can happen in these patients is because during the gout flare, remember the uric acid is now lower in the blood and it's now sitting in the joint as a crystal. So even though the patient has a typical gout flare, the uric acid level may not be high anymore in their blood. And in this case, sometimes the joint has to be drained of its fluid, and the fluid can be looked at underneath the microscope, and then crystals can be seen.